My name is Catherine Price and I'm a physical therapist. Today I'm going to go over an exercise routine for someone that has osteoporosis as well as shoulder tendinopathy and knee pain. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. First, I'm going to start with a word of life from Proverbs 14:30. A heart at peace gives life to the body, but envy rots the bones. So today I'm going to talk about bone health and get a routine that is going to help keep the bone strong. So we have evidence in our body that the bone responds to the forces placed on it. So for example, we've got the tibial tuberosity where the patella tendon is attached. There's constant pull in the bone there, so we have bone growth there. So when the muscles are nice and strong, they are going to pull on the bone and keep the bone healthy. And we want to keep strong, healthy muscles as well as bones. So you may hear that weight-bearing exercises and having weight on the body is going to stimulate that bone growth and keep the bones healthy. So before you do start this exercise routine, you may want to do 20 minutes of weight-bearing exercise or resistance exercise such as swimming or biking to get with resistance and or walking to get weight bearing. So what I'm going to do is release, stretch, and then strengthen. And the release is to help with the knee pain. And then we're going to go into stretching to help the knee pain as well, and then get into the strengthening. And I'm going to show you exercises that will help with decreasing the pressure on the tendons in the shoulder where you can get tendinopathy. So with osteoporosis, you see a lot of times that there's a dowager's hump or there is a curvature, and that can then position the shoulder tendons in a compromised position to be compressed and develop tendinopathies there. So exercises that are going to strengthen the back muscles, they become overstretched and weak. We want to strengthen the back muscles and put the body in a good position so that the shoulder is in a healthy position and not irritated. And then we also want to address the knee. Now, with osteoporosis, a lot of times the bone density is measured in the hips and the low back. And so if the hips lose their bone mass, then they are more at risk of fracture. And we know that hip fractures, there is a higher mortality rate in our older population. So we want to keep strong hips, and with strong hips, that can sometimes help the knee pain as well. So we're going to do exercises that are going to prevent the tendons in the shoulder to be compromised. We're going to work on posture, strengthen the back muscles, as well as strengthen the hips. So let us begin. The first thing we're going to do is the releases. And the equipment that I'm going to have is I'm going to use a 5-inch ball. Softball size is going to work just fine. I'm going to have some resistance bands, and so whichever resistance is going to give you a challenge. You want it to not be too easy, but also make sure that it's doable and that you're keeping good form. I'm going to use a foam roller, and I'm going to use a therapy ball. So the first thing I'm going to do is release my quads. Now, if you're going to be on your knees, you want to be on soft surface. So you want to come down onto the roller. If I'm starting from a standing position, I can just forward fold, and I can walk my hands out, my legs back, and bring my quads or my thighs on top of the roller. With my shoulders, I want to position the elbow underneath the shoulder, but I want to roll such that my elbow is going to be below the shoulder. I don't want to go way up here. I want to stay right underneath. And I am just going to release the tension on the quadriceps muscle. So if I feel any tenderness there or tension, I can hold on that area, bend my knee, and then relax. So I'm just going to spend time just releasing the fascia and any trigger points in my quadriceps. That is just going to help us when we stretch that muscle. So I'm releasing the quadriceps. I can do this for about 2 to 3 minutes, however long it takes for the pain or the tenderness to decrease. If there's no tenderness or tension, then you can be done with that. After I do that, I'm going to come back up and I'm going to use a chair, a hard surface, and then I'm going to release the hamstring. So I'm going to place the soft ball, the 5-inch ball, underneath my leg, my thigh, and I'm going to find an area that feels that I feel tense or tender, and I'm going to hold it there, and then I'm going to straighten my leg and then relax. I'm going to straighten and relax, straighten and relax, straighten and relax. And again, I just want to spend time doing this until the tenderness or tension decreases, and then switch to the other leg. And here I want to do both legs. If you have any pain with the rolling or the release in the knee, then you don't want to be doing it. So you can have tenderness right where there's pressure, but not in the knee. If there's pain in the knee, then don't do this exercise. And so here I am just going to release the tension off the hamstring. And I can spend as much time doing that as I need to. Then I'm going to come down onto the floor and I'm going to place that softball underneath my calf muscle, and I'm going to go perpendicular against the muscle. So I'm going to go side to side, and then I'm also going to go parallel. And I can, once I find an area that feels tight or tender, I'm going to then go perpendicular and try to release that tenderness or tension. I can pump my ankle up and down to further actively release that, and then switch to the other side. Again, spending as much time as I need to release that tension there. So once I have released my quad, my hamstring, and my calf, I'm then going to go through some stretches, and then we will be on to our exercise. Now, if there's pain in the shoulders when you're holding any of these positions, you don't want to do them, but I'm just releasing the tension on those areas. So I'll go back. So we have rolled the quads, so then we want to stretch the quad. I can do this on my side or standing, but I'm just going to bring one leg back, and I'm just going to hold this for 30 seconds. And you may want to pause and go through these thoroughly. For the sake of time, I'm going to go through them a bit quicker. So I'm just bringing that heel all the way to my butt. And I can keep it parallel to my leg. If I feel like I need more stretch, I'm just going to bring that knee back. I don't want pain to be in my knee. I should feel the stretch in the thigh. If there's pain in the knee, then go back to rolling the thigh and then try to go back into the stretch. But you want to stretch the quadricep, bringing that leg back. And I want to do 3 times 30 seconds. If you are older than age 30, 3 times a minute is more effective. But just to get the legs loosened up for what we're going to do is where we want to start. And I am going to use some weights as well. So we're going to use a therapy ball. We already used the 5-inch, the softball. We won't use that again. And some resistance bands. I'll relax out of that. Go right back in. And relax. And then my last one. Holding for 30 seconds. And relax. Then I'm going to stand, and I'll use a wall or a chair, and I just want to stretch the calf muscle. Again, holding 3 times 30 seconds each leg. For the sake of time, I'm going to go through these quickly. So I'm just pushing the heel down and holding that, getting a good stretch on the back, the lower leg, and switching. Holding that stretch. Shouldn't be any pain in the knee. And switching again. one more. And then we're going to stretch the hamstring. And last one. Okay, you're going to want to hold those stretches a lot longer than I just did, but I'm just going to move right along. You want to keep a straight back, the legs stay straight, and you're going to lean forward and hold to get the hamstring stretch. So you want to stretch the calf, the hamstring, and the quadricep if you have knee pain. And then I'm going to switch to the other leg. Keeping a straight back, leaning forward. And you want to have your physical therapist assess you. You may have something going on in the hips or even in your foot that may be contributing to the knee, and you can have an evaluation to assess for those areas. And switching. But this is a good place to start. And switch. So osteoporosis is bone density reduction. It's the loss of bone mass. And so you want to do the resistance training to stimulate the bone and the bone growth, but then there is a nutritional component, and there are many vitamins and minerals that are going to make up bone. So it's important to get the nutrients to be able to build that bone as well. And switching. And last one on the opposite side. Again, I would hold these longer. This is just to introduce that stretch, but you want to hold at least 30 seconds, and I'm probably half that time. All right, so that was the releases and the stretches. The first exercise that I'm going to do, I'm going to grab my band, is going to be for the shoulders. So what I want to do is I want a nice stance, slight bend in the knee. My shoulders are going to be anchored down. I want to hold my bend with the palms facing up, and I'm going to rotate the band out and bring it right back in. And I'm going to do 20 of these. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. And then just take a pause, deep breath, all the way out. Tighten your abdominals, bring your navel to your spine, slight bend in the knee, palms facing up, and squeeze your shoulder blades together, rotating the palms apart, out to the side. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, last one, 20. And take a pause, take a deep breath in, all the way out. And last set of 20, these are endurance muscles, so I'm going to do 3 sets of 20. Palms up, tighten your abdominals, navel to your spine, rotating, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, the next exercise I'm going to do, I'm going to grab the back of a chair and I'm going to stretch my shoulders. So if I have shoulder pain, I don't want to do this, but if I can get in this position and keep a nice shoulder flexion stretch, I'm going to hold here. I'm going to tighten my abdominals, navel to my spine, and then lift my legs so it becomes parallel to the floor and bring it right back down. 2, 3, 4, 5, 6, 7, 8, I'm going to do 10, 9, 10, and then I'm going to switch legs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch back to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Then I'm going to grab my therapy ball and I'm going to lie onto my back and I'm going to place the ball right between my ankles. So I'm going to be flat on my back, ball between my ankles. I want to keep my spine on the floor, so you want to get your back flat against the floor. If it's arched off the floor, then you do want to strengthen the abdominals before you do this exercise. So I'm going to keep my back against the floor. I'm going to squeeze in with my ankles, and I'm going to lift the ball up and lower it down. And I'm going to do that 10 times. 2, 3, 4. Do not do this if you have back pain. 5, 6, 7, 8, 9, and 10. And then take a pause, take a deep breath in, all the way out. Make sure that you're keeping your back against the floor and not allowing it to come up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then take a pause, take a deep breath, all the way out. You can even let the legs down, but you want to keep this flat. And another set. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. And then I'm going to lower that down. Next, I'm going to grab my band that is a loop, so I have a loop, and I'm going to place it around my ankle, and then I'm going to stand and do monster walks. So I'm going to move the chair, and I want to get a space where I can sidestep back and forth. So I'm going to start down here. I'm going to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, back to the right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to the right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that's going to strengthen the abductors, and you should feel that on the sides of the hip. And then I want to continue to work on that muscle. So I'm going to come down onto the floor. I'm going to keep that band around my ankle. And these, we're going to do 3 sets of 20 side hip abductions, so against resistance. Now you want your shoulder to be comfortable, so however your arm is comfortable, whether you can bring it down by your side or you can even bring it up as long as it's not hurting the shoulder. And so just lift up against resistance. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And I'm going to do the other side. So I'll switch back and forth, and I want to do 3 sets of 20 of these. All right, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And then I'll switch to the other side. And if it feels like it is burning and it's getting harder to keep the form, then you can take the band off and do this without resistance, or you can start with 1 set of 20 and build up to 3 sets. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. You should be feeling that on the outside of the hip. Switching to the other side. Another set of 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And with this strengthening work, I would recommend doing them 3 times a week. You want to let the muscles recover, and you want to continue to keep them challenged. So you don't want it to become easy. And if it does, you just want to increase the resistance. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And our last set on the other side. After this, we're going to go into bicep curls, and I am going to use some weights for that. So last set on this side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And that is going to be the hip abduction. So you should feel that working on this side of the hips here. I will grab some weights. And after you do those, when you get up and walk, it should almost feel like you're floating. So bicep curls. I want my feet facing forward. Your toes can be slightly out. My navel is going to be to my spine, so I'm going to get a good core contraction. And then I want to do 15 bicep curls. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and take a rest. These are 9 pounds. You can use anywhere from 5 to 20 pounds. So as it gets easier, you want to increase the weight. Another set of 15. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and pause. Take a deep breath. All the way out. And last set of 15, slight bend in the knee, toes facing slightly out, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and rest. Now, this is great for the shoulder as well as with the osteoporosis, the posture, and strengthening the back extensors. These are called black burns. I'm going to then lie on my stomach. I can roll up a towel or rest my forehead on this pillow. I'm going to bring my arms down by my side, and I want to pull my shoulder blades down and back, and then lift my arms and hold for 5 counts. 1, 2, 3, 4, 5. I'm going to do 10 of these. Down and back. 1, 2, 3, 4, 5. Relax. Down and back. 1, 2, 3, 4, 5. Relax. Down and back. 2, 3, 4, 5. Relax. Shoulders down and back. Lift. 2, 3, 4, 5. Relax. 5 more. Down and back and lift. 2, 3, 4, 5. Relax. Lift. 2, 3, 4, 5. Relax. Down and back. Lift. 2, 3, 4, 5. Relax. Down and back. Lift. 2, 3, 4, 5. Relax. Last one. Down and back and lift. 2, 3, 4, 5. Relax. Then I'm going to bring my arms, my elbows in line with my shoulder, and I'm going to turn my thumb so it's facing up towards the ceiling. I'm going to squeeze my shoulder blade and lift my arms, and do that 10 times. 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a pause, deep breath. And again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pause, take a breath. Last set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. Then I'm going to grab my therapy ball and I'm going to do some bridges on the ball. And here I am going to do 2 sets of 20. So I'm going to lie onto my back. I want to keep my spine nice and neutral. I want to squeeze my butt tightly. And I'm going to lift my bottom off of the floor. So I'm going to lift straight up and come right back down. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, last one, and 20. Taking a deep breath all the way out. Last set of 20. Keeping my legs straight, my knees straight, and squeezing my buttocks and lifting. We're using our spine extensors and our buttocks. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, last one, and 20. All right. Next, we're going to do a chair position hold 3 times 30 seconds, and then we're going to finish with some leg strengthening. So the chair position, you're just going to stand. You're going to sit back as if you're sitting back in a chair, but your knee's not going to go over your toes. So you want to keep your knee in line with your second toe. And then I'm going to bring my arms up and forward and hold for a count of 30. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. And relax. Taking a deep breath in. Another set or another repetition. Dropping into that chair position. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 29, 30. And relax, taking a deep breath. Our last repetition, draw your navel into your spine, take up a nice tight core. I'm going to drop down into that chair position, arms forward, and 30 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and relax. 2 more exercises. So next we're going to do squats with our weights. So these are the 9-pound weights. I'm going to bring my feet shoulder width apart. I don't want the knee to go past my toe when I squat down. I'm going to hold the weights just on my shoulders, but I'm not going to be pushing the weight up at all. So the weights are just meant to add a little bit of resistance for the legs. So I'm just going to squat down, keeping my knee in line with my second toe so that the knee stays healthy. 2, 3, 4, 5, 6, 7, 8, 9, last one, 10, and pause. We'll do another set. Taking a deep breath. And again, 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10, and pause. Next, I'm going to do, with the free weights, just a deadlift. So I'm going to squat down and then lift the weights up, but I'm not going to arch my back as I bring them back, but I'm going to squeeze my shoulders down as I come up. And the weights are just going to stay in my arms. So we'll start here and come to here. So 1, touch down, and then back up. 2, down, back up. 3, down. 4, touch down. 5, touch down. 6, do not do this if you have knee pain. 7, 8, 9, 10, and take a pause. And then one more set. So with the release, the stretch, and then the prior exercises, it should prepare the legs to be able to do this and the knees without any pain. But if you're having pain, do not do them. We got one more set. So touching down, knee doesn't go past the toe, and then comes right back up. 1, 2, touch down. 3, touch down. 4, 5, 6, 7, 8, 9, 10, and relax. So that completes an exercise program for someone that has osteoporosis that also has some shoulder tendinopathy and knee pain. Again, do not do any of the exercises if they are painful, and consult your medical doctor or physical therapist for the appropriateness of exercises for you. And have a blessed day. Thank you.